Eyewitness News presents NEWSMAKERS, winner of the Pennsylvania Association of Broadcasting Award for Excellence in Public Affairs Programming, with your hosts, Jane Ann Bugda and Andy Mahalchik.
Hello and welcome to NEWSMAKERS. I'm Andy Mahalchik.
And I'm Jane Ann Bugda. COVID-19 has impacted our lives in many ways, from social distancing to financial stress and job loss, leading many of us to feel depressed or have some anxiety.
Today we are joined by a panel of experts to help us better understand how we are feeling and how we can cope with these trying times.
When we come back, we'll introduce you to our guests, and our conversation will begin when this edition of NEWSMAKERS returns right after this. Welcome back to NEWSMAKERS. I'm Jane Ann Bugda along with Andy Mahalchik. During the COVID-19, the virus, many of us are feeling a lot of anxiety, little depression, because we're dealing with a lot of feelings we haven't felt before. So today we've invited some experts on with us to talk about our mental health and how we can cope with feeling anxiety or depression. So we are joined by Dr. Matthew Berger. He's a local psychiatrist, and he brought along a team of counselors with him: Tina Gordon, Jessica McDonough, and Kyle Strobel. They're here today to talk to us about how we're feeling and how we can cope through this time.
Yes, indeed, Jane. And let's start off with an open question, folks. Anxiety. What is anxiety, and how is this anxiety where many of us are feeling with COVID-19 a little bit different than, I hate to say run-of-the-mill anxiety, but it's a different animal. Can you expound on that a little bit, Dr. Berger?
Sure. So anxiety is very prevalent. We've all felt it at some point in our life. I mean, if you've had an exam to take or there was some sort of stressful situation, you feel anxiety. And anxiety is a normal part of the human condition. And in fact, on some level, anxiety is good because if you're anxious about an exam, you study for it. If you're anxious about your finances, maybe you look at what you're spending. So anxiety can be a motivator. But at some point, anxiety can become actually a negative and impede your function. And anxiety is the great mimicker. It can look like virtually any number of symptoms. One of the things we see a lot of is sort of what we call somatic complaints, which are physical manifestations. And anxiety can be very mild, all the way from mild performance anxiety, all the way up through full-blown panic attacks, which can lead to agoraphobia. I think we're seeing a lot more anxiety during the COVID pandemic, because many of us haven't had to deal with this kind of stress in our lifetimes. I mean, we've lived a very, for lack of a better word, soft life where we haven't had natural disasters like this. But actually, the human condition has had to deal with these kind of things for forever and generations. So I think anxiety is a very common symptom. And again, it can manifest itself in many, many ways.
And normally we'd have you all here in the studio with us. So being disconnected from our normal routine, can that lead to anxiety? For example, like working from home, how can you address this when you're away from colleagues and friends? And
humans are social animals, and we all have a tendency to want the companionship of those around us. And we also get a sense of safety and solace from friends around us. I think, Tina's been dealing a lot with the family situation. So we're also seeing families where loved ones can't come see each other, things that are part of our normal routine, weddings, funerals, birthday parties are more difficult. So maybe Tina could address a little bit how families are coping with the anxiety of being separated.
There are a lot of things that are contained in all of this. That first of all, families who are used to working, and perhaps one of the people in the family is not working anymore, so you're dealing with employment issues, income issues, but mainly it's about connection and it's about loss. The families are feeling a lot of loss of structure, of routine. They're having to reinvent it. They're missing their family members who now they can't visit, perhaps in hospitals or in nursing care facilities. Or if someone gets sick, they have, should we take them to the doctor? They have to deal with that. And so they could start to become more depressed and more anxious and trying to figure these new things out that they haven't had to deal with before. It's a lot of loss. And I think that's the main theme with some of these families. There's also the tension of the families being, together all of the time, whereas before the children were going to school and maybe parents were working, and now they're all together. So that also could increase the possibility of tension and emotional tension and other things like substance abuse, domestic violence. That's something that, families are dealing with. So
yeah, I think that's
a lot.
Really important. That one of the things that I think we need to address, and I'm sure we will as this discussion goes on, is the whole concept of the secondary fallout. We talk about the deaths from COVID, and one of the great fears, of course, is many of us have a fear of dying alone. And many of our loved ones, unfortunately, are, when they're hospitalized or in nursing homes currently or in these kind of facilities, unfortunately can't get to their loved ones. So the person holding your hand or bringing near with you is often sometimes a stranger, a nurse, a doctor, someone else you don't even really know. And even there, I think there's a little fear amongst healthcare workers. Unfortunately, I myself go to 3 different hospitals, and there's always a little concern. I wear the mask and do all the right thing, but you're always a little nervous about going into an environment where you don't know where COVID's going to be. One of the things that we've had to deal with is the healthcare worker strain, and there's a lot of talk about burnout in that situation too.
Is it really, of course, the unknown? Because if you have an enemy and you can see it, for example, we were talking in the newsroom the other day, over the last several months, about, we've covered all kind of natural disasters, from terrorist attacks, flooding, snowstorms, you name it, economic crises, but this is something you cannot see. You know it's there, you see the impact, but the fear of the unknown, is it even bigger than ever before, guys?
I think the fear of unknown is very difficult for us too, and I think, and maybe one of the other panel members could chime in on this, is the constant drone from the news.
Okay, and well, if somebody wants to continue that, as Dr. Berger was saying, we lost him there a little bit. But what happens when someone is seeing the news constantly and hearing about this? Is that playing? I'm sure it's playing a factor in how someone is feeling.
Yeah, I think that there's exposure burnout going on. There's this thing where it's good to have information and to be informed, but unfortunately what happened is that it's coming so fast and furious that people aren't getting any kind of reprieve from it. We're turning on the news and it's on the news, or we're talking to our family and we're talking about it with them, or then we go on social media and everybody has opinions and they're posting articles, and it's hard to escape something that's worrying you if it's constantly right there in the forefront. Don't you think, Kyle?
So yeah, one of the things that I work with a lot of people on is trying to reduce some of the distractions. And when it comes to the news, it's good to watch the news cycle just to keep up to date on what we need to do in best practice, what we need to do to take care of ourselves. But when someone can keep the news on for hours at a time, and it's that constant exposure, and I think that kind of influences or can kind of increase that anxiety in a person. And so for a lot of people, it's just that simple act of setting a boundary where I can get the information that I need, but then I can take a step back and kind of look at what my needs are in this. Do I need to be watching the same cycle over and over again, or can I just maybe step away and take care of myself, or do what I need to do, whether it's connection or just doing something for myself?
I also think one of the concerns is that I think sometimes we don't get the reality of the situation. If you look at the actual numbers, the incidence of fatality from COVID in like 0 to 40 years old is only about a 0.2%. The old expression, a coward dies 100 deaths, but a brave man only once. I think the fear of the disease can be almost more debilitating than the disease itself.
It's interesting, Dr. Berger, you mentioned that, because I know a lot of folks, and I'm sure we all do, where, for example, I go out into the public, and by what I do as a profession, as a reporter, a journalist, we're out there covering events. So I'm the only one in my family who's out in the public and exposed. So when I get home, quite honestly, I stay away from my family. I quarantine myself. I feel fine, that kind of thing, but I don't know what I'm bringing home. I take precautions, but part of me wonders, if something comes in this house, it's most likely coming from me. So how does it add to the possible guilt for people or even more anxiety?
Well, I think really, we are becoming obsessed with this, and it's obvious it is a reason for us to be worried. But this whole worried well concept of people who honestly are completely asymptomatic and are not in a risk group. I mean, if you're 0 to 17, the total number of deaths in that age group has been 3 in the United States. Yet, we have kids that we're creating this fear factor in, and I think that's something Kyle might want to address: is how children, they feed off our fears. The little ones are the ones who really are being strained by this because they see the fear in the adults and they don't understand it. They're being kept away from friends and family. And I guess, Kyle, I know you deal with a lot of kids. How are they adjusting to that, and how do you suggest they adjust?
Well, in working with the adolescent population, I find it's across the board in terms of how kids are dealing with it. Some are dealing very well with it. And I think a big piece of that is having an open conversation about what's going on. And so with kids and seeing how they've been experiencing things, it's the same as adults. We've been taken out of our daily routine. We've lost all the structure that we're typically used to. And it's trying to rebuild that structure. And so a lot of the kids I work with, it's about setting a routine, trying to maintain a sleep schedule. I've seen a lot of sleep schedules going off from that normal, say like bed by 10, up by 7 or 8 in the morning, where kids are going to bed at midnight to 3 a.m. and then waking up around noon. And that really can create some dysregulation emotionally. And even with connection, because if you're sleeping till noon and you're up till 3 a.m., who are you talking to in the hours of the night? I also notice in terms of social patterns, a lot of that has changed for adolescents in terms of we're not going to school every day, but we're still able to maintain some connection through social media, which isn't always the healthiest. But in this situation, it is one of the only outlets that they have for connection. And then the other component being video games. A lot of video games being something that adolescents can do online as a way to connect with peers and really connect with others in their age group.
And I also think it's important for parents to not convey a overwhelming sense of fear that, we're all going to die kind of thing. I think kids, especially younger kids who really can't process this, on a cognitive level, but just are processing on an emotional level, it almost becomes like the boogeyman, the evil COVID is going to come get me in the middle of the night kind of thing. And I think it's important for us as parents to convey a reasonable caution, but also a reasonable, we're all not going to die. The school, world will go on. This is not the end of the world as we know it. And I think if we get into that mindset, then I think it plays out to our children and they get into that mindset and they don't have the coping skills that we do a lot of times in terms of cognition.
I want to jump in too here and say that I think it's important that we're modeling for kids with ourselves, like meeting yourselves with compassion in the moment. There are going to be days that you wake up and you're ready to go and you're going to do your online work and your kid's going to do online school and it will be great. And then you might wake up tomorrow and you might feel like absolute garbage. And I think it's important to normalize that feelings are going to fluctuate and big feelings are okay. And you can get through those. They're not the boogeyman. It's not something that if I have a big feeling, the world is ending. Big feelings are there to tell you that you're going through something. And that's when the kids need you the most to say, it is okay to have those big feelings and we're going to get through this together.
Have you seen...
I have to
Go ahead.
agree with... I'm jumping in to agree with Jess and Kyle about children, and also important to recognize when there are possible symptoms of anxiety in the kids, because we're going to have them, they're going to have them. So when we start to recognize what's, some things that don't seem normal, or if the child is tantruming a little more or a little more whiny, it's important to appeal to them in a way that isn't, and I agree with everyone who just spoke about it, it's important to appeal to them reasonably and not for us to become anxious at their restlessness or their anxiety or their occasional tantruming, because it isn't easy getting through this.
Yeah. And I also think, we need to make sure that we're aware that, it is okay for kids to go out and play in the backyard. It is okay to go to the parks. You can do appropriate social distancing, and at the same time, you don't have to lock yourself in your home. You are seeing people who have taken it to that level, who have not left their home in 6-8 weeks, who unfortunately are not in a high risk group. I mean, if you're 75 and have comorbid diabetes, hypertension, and COPD, you need to be very careful. If you're a 20-year-old with, or a 25-year-old with a 2-year-old, go out and take a walk. Go to the park, play on the swings. That's okay. We do not want to get in. I think this is, again, talking about how our own fear plays into the fears of our children and people around us. You don't have to lock yourself into your home. The vast majority of us are okay.
And you're talking about children, but then on the other end of the spectrum, we have a lot of our older seniors that are unable to see family members and may be home alone. So what should we be looking for in a loved one who may be older and may be experiencing some anxiety and stress? And what should we be looking for as family members who, we're not in the same room with them now. So what should we be looking for when we're talking to them on the phone or FaceTiming with them?
Well,
I was going to say, I think everybody is experiencing anxiety and stress to some degree right now. And so there's a little bit of a call to action in terms of making an effort to be more present and available via telephone, via email, text. Reach out and make sure that your friends and loved ones are okay. This is one of the great things I've seen come out of COVID, even though that sounds like a counterintuitive thing to say, is that it is really forcing us to reconnect with people in a meaningful way. And I think that that's actually a really beautiful thing. It's slowed life down, and we're forced to have conversations with the people in our house now because we're staring at them, right? But also our loved ones who we're not living with, calling and checking. Are they isolating? Are they not calling you as much as they used to? Are they sleeping all day?
Yeah, I think that elderly is especially vulnerable too. Because they're number one, a physically vulnerable category. So if you're in your 70s, 80s, 90s, you're physically more vulnerable, and you really do need to be in a hard quarantine, and so they're even more isolated. One of the truly great things about our society, but also one of the truly terrible things about our society, and I think Tina can address this, and so we all can, is the fact that we are disconnected. Kids can live in California, you don't have the extended family that you used to have. And sometimes, unfortunately, local communities aren't as integrated as they were 30, 40 years ago. So I think that population is especially vulnerable. So if you see things in, some of the signs and symptoms of depression or anxiety in the elderly, weight loss, change in appetite, change in sleep, somatic complaints, I've got headaches, I've got stomach problems, increased chronic pain. I hate to say it, but the elderly population, unfortunately, oftentimes will turn to substances, not like some will be drinking, but also over-the-counter or even, prescription medications. A lot of times, they'll be taking more pain meds or more anxiolytic medications in a form of self-medication because they don't know what to do to deal with the anxiety, and they are truly isolated.
Well, we are going to continue our conversation, but we're going to take a quick break. And you are watching Newsmakers. We are a proud recipient of 3 Pennsylvania Association of Broadcasting Awards for Excellence in Public Affairs Programming. Information on today's program and information about our guests can be found on pahomepage.com or under the Newsmakers link, and we'll be right back. Welcome back to Newsmakers. I'm Jane Bugda along with Andy Mahalchik, and today we are talking with Dr. Matthew Berger, local psychiatrist, and members of his team, Tina Gordon, Jessica McDonough, and Kyle Strobel, and we're talking about our mental health during this time of COVID-19 and how it's impacting every one of us. We're all talking about it, and it's something that's now become part of our lives. But before the show, we were talking a little bit to the team, and we were asking them how they felt, because now they too are also experiencing what we're experiencing. So how does this change the way in the way you are talking and treating people? Because you also are feeling what the experiences of COVID-19.
Well, I can
Go ahead, please.
I can throw something in about what's really important is, number one, I'm very grateful that I can still connect with people through the telehealth system. And so it is great to be able, especially to be able to see their faces. So for that, I think it's really positive that we can continue connecting, because what I found out is that people are telling me that they're grateful that we're connecting and they're glad there's a place to go and people to talk to and checking in with them every week and that kind of thing. And there's also one other neat little aspect is I get to see their pets and their artwork and, you know, other parts of their family that I wouldn't normally get to see.
Yeah, and I think that one of the things that we've looked at is that we create a sort of a little bit of a level of normalcy in their lives. That, you know, a lot of people find us as like, oh, you know, I'm glad knowing that you're there and knowing that you're still continuing to work and operate has really given them a sort of a sense of an anchor, a grounding that they would not have. And we've been very lucky that we do have the telehealth system. I wonder where we would have been if this had hit 20 years ago. Before the mental health system was as online. And we've been very fortunate in our practice to be able to be up and running almost seamlessly with our patients. But I also think that one of the things that happened is we're also seeing that we're getting, you know, there's a burnout that occurs for the healthcare workers, not just mental health care workers, but healthcare workers in general. Unfortunately, the mental health system was already strained, but we're looking at they think, according to the national statistics, 31% of practices in mental health have had to turn people away simply because they don't have the wherewithal to see them. Many programs have closed. Many programs have not been able to continue seeing them at the same pace. So it's really left people without an anchor, adrift. So I think it's important. But I think the other thing is maybe we can address, one of the team can address how we deal with our own personal stress of being sort of the empaths as people kind of dump their stuff on us and how we kind of keep ourselves grounded.
I can speak a little to that. And so a lot of people have been coming, I mean, to all of us to some degree and just dealing with this large transition that we ourselves are dealing with. And so I try to draw what works for myself and really try to bring that to the conversation. And a lot of that's about just maintaining the structure of daily life. We are all fortunate enough to be able to go to work every day, even if it's from our home office and connect with people. A lot of people don't have that. And so we may be their only connection in the day. So it's really trying to encourage connection for them to maintain being able to talk to others. Now, people who are able to work from home, and this was a big thing for me, it's maintaining a workspace. Because I know for myself, I don't want to be working out of my bedroom or my kitchen. And so if I have the possibility to kind of move to a separate room, whether it's a guest bedroom or if you have a home office, just trying something along those lines to create a separation. Because now we're not leaving the house and getting in our car to go to work, but we may just be walking up the stairs or down the hall. And something that just came up today, it's the idea of just getting dressed. So we're on video calls, and so we're doing this every day. And so we do get dressed, but I was speaking to someone this morning who mentioned like they put on work clothes these last few days and it made them feel 10 times better. And so it's things that I'm not always thinking about being on the video calls, but it's something that is very important just for feeling good about yourself. Because if I'm wearing the same clothes I wore the last 2 days, I'm not going to feel as on top of myself or as good about myself if I'm not kind of taking the proper care of myself.
If I can, folks, what about families in there? There's always, you know, there's folks are considered strong leaders of the family, the rock of the family, but they're feeling it also, and maybe they feel they're letting their family down. What do you want to say to those folks who maybe aren't expressing their feelings to anybody, and they're trying to hold it in and be the, you know, buck up and I'm here for the family, but they're also being torn apart inside emotionally? What do you want to say to those folks?
I would love to jump on that one because I think that's so common in our world. In the United States, we're the pick yourself up by your bootstrap culture, right? There's never a time to, you know, wallow in it. And there's all of this stigma around that. And what I often will say to clients when they talk to me about that is, imagine you were teaching someone to ride a bike. Would the child be more motivated or less motivated if you were saying, you're a dumb idiot every time they fell off the bike? Or would they be more motivated by some compassion and some kindness? You know, this is hard. There's no doubt about it, regardless of where you are in the family structure. This is hard. And For people who are providers, who get up and go to work and their love language is providing for their family, this is especially hard because they feel like their hands are tied. So I think giving them space to talk about that if they want to, or adversely giving them the space to not talk about it if they don't want to. We have to meet people where they are, but I think saying to them, I see you, I know this is hard, I appreciate you, and we're gonna get through this together. And that might sound a little feel-good therapist-y, but it's true. It's really true. We have to be compassionate to each other.
And we have about a minute and a half left, and I do want to ask this. As we're getting back to what will be a new normal, or getting back outside and getting back into the swing of life, will these feelings go away, or will they stay with us for a while?
Well, I think it really depends on how we get back into life. I mean, I hate to say it, there are people who are saying to me, I don't know if I'm going to be able to go out of the house until 2022, you know what I mean? Until I'm sure that there's a vaccine and you know, we're completely safe. The world has never been a completely safe world. I mean, you know, you could walk out of your house and get hit by a meteor. So I think we need to kind of come to terms with the fact that our own mortality as humans, we're all, you know, human, and that there is no specific playbook. There's no do this and it's the right way. It's whatever way works for you is the way that you can get out. Use your support system, use the people around you. But I think that we need to come to terms with the fact that we have to live our lives, you know, again.
And we do. And we want to thank Dr. Matthew Berger, Tina Gordon, Jessica Madonna, and Kyle Strobel for joining us today. This show flew by. We have information on today's show and information on our guest on pahomepage.com under the Newsmakers link. For Andy Michalczyk and everyone behind the scenes, thank you for making Newsmakers part of your day, and we'll talk again next time.